How's it going? My name is Nitzan Friedman. I'm working with Professor Bachman and Professor Rankin-Smyer on a project for a way to involve patients in low-cost rehabilitation. So over here we have a glove. This is actually a MIDI glove that's used for at-home setting for patients who have difficulty moving their fingers and arms. So right now when a patient gets out of the clinical setting, there's no real good form or way for them to engage in meaningful hand movement. So over here you can see if Danny touches his thumb to one of these 5 sensors over here, he generates a note. And what I'm trying to do here is I'm trying to create a way for the patient to engage in pinch and grasp functions. These are the most important functions for activities of daily living. So over here we're going to have Danny play along to a song. This is going to be the Eagles' Peaceful, Easy Feeling. And so as you can see, this is a motivating way for Danny to play an instrument and also at the same time use his fingers in a meaningful way. I developed the
practice.
Right. So I developed the technology. I developed the glove. I developed the interface behind the glove, enable patients to really get motivated in these movements. So this is just one application of the glove. There are multiple applications. I have one where it's a memory game. The patient has to listen to something and recall it. I also interface it with Guitar Hero. So Guitar Hero is great because the patient has to look at a screen and touch the signal an event in a certain amount of time. And if he doesn't, he's not going to hear it. And also, the patient receives quantitative feedback at the end of Guitar Hero. So the patient sees, I got 50% this time, I'm going to want to try to do better. And the other benefit is that at the end of the day and at the end of the week, when the patient wants to go to the physiotherapist, the physical therapist can see how well he's done over the course of the week. So quantitative assessment is very important for this particular approach.